Pursuant to the order of the House on February 17th, 2011. Gentleman from Iowa, Mr. King, and a member opposed, each will control 5 minutes. The chair now recognizes the gentleman from Iowa.
Thank you, Mr. Chairman. This amendment number 267 is an amendment that is narrowed in its scope in anticipation of the point of order that was raised by the gentlelady from Connecticut, and can't help but reflect what it must have been like in this body before the invention of television. But my amendment number 267 says this, in pertinent part: funds made available by this act, no funds made available by this act may be used to carry out the provisions of Obamacare. So what this does is, for the appropriations that go on outside of the scope of this continuing resolution, we've lost that point of order. But this amendment goes to those funds that are appropriated within it, down the exact same path as the Rehberg Amendment, except it goes to the outside of the particular Department of Health and Human Services as the narrower scope of the Rehberg Amendment. So this goes broader than just HHS, but it does go directly to shutting off all funds within this CR that would be used to enforce or implement Obamacare. And I've made my arguments, Mr. Chairman, on that, and I would yield, or I would reserve the balance of my time.
Gentleman reserves the balance of time. Who claims time in opposition?
Mr. Chairman, I claim the time in opposition.
Gentlewoman from Connecticut is recognized.
I yield a 1 minute to the gentleman from Connecticut, Mr. Murphy.
Gentleman from Connecticut is recognized for 1 minute.
Thank you, Mr. Chair. Poll after poll shows that Americans oppose repealing or defunding health care. The latest one says 62% of Americans oppose these efforts. Why? Because they figured out that the nonsense coming from Republicans over the last several years about this being socialized medicine or government takeover is just that. It's nonsense. What they figured out is that this is helping millions of Americans all around this country. Millions of Americans, like a little 8-year-old boy named Kyle McCullough, who had the courage to walk into my office yesterday and tell me about his battle with hemophilia. He has to put out $10,000, his family does, $10,000 a month to pay for his medications. And a repeal of this legislation means bankruptcy for his family, and for him, a lifetime of worrying as to whether he has a job that covers his illness or whether he has the medications to stay alive. That's why 62% of Americans oppose what the Republicans are trying to do on this floor. And for anyone that votes for this, they have to have an answer to them, and they have to answer to little Kyle McCullough. I yield back the balance of my time.
Gentleman's time has expired. The gentleman from Iowa.
Mr. Chairman, I'd be pleased to yield a minute and a half to the doctor from Louisiana, Mr. Fleming.
Gentleman from Louisiana is recognized for how much time, sir? 1.5 minutes?
1.5 minutes.
1.5 minutes.
I thank the gentleman from Iowa. Mr. Chairman, one thing that's lost in this debate is this fact, and that is there's a difference between coverage and access to care. I've been a physician for 35 years. I can tell you that today, pre-Obamacare, we have 85% coverage, but we have 100% access to care. Anyone who wishes can report to any emergency room in this country and receive care. Now, they may receive a bill, but if they pay that bill or not, they can still return for care. Now, let's move to Canada and the UK, where they have supposedly 100% of coverage. Well, they oftentimes wait a year, maybe 2 years, for a CT scan or an MRI scan. And then once they get the results back, they may wait another year to get surgery. It's not unusual to be told, hey, we could have helped you had we made the diagnosis in time. It's perfectly acceptable in these countries to have a death rate from lack of treatment. Look at the death rates from cancer, prostate, breast cancer in our country versus others. A horrific difference. Why? Because we diagnose it much earlier. We treat it much more aggressively. But if we go forward with this Obamacare, then what we will have is budgets coming up against the decision on what type of care our citizens can receive. We'll be taking it out of insurance companies, but yes, we'll also be putting it under the hands of the government. With that, I yield back.
Gentleman yields back. Gentlewoman from Connecticut.
Yes, I yield 1 minute to the gentleman from New York, Mr. Owens.
Gentleman from New York is recognized for 1 minute.
Thank you, Mr. Speaker. I come before you today after spending 27 years in the healthcare industry representing my local hospitals, and I can tell you that this bill was supported by them because it creates care in our communities and it creates jobs in our communities. If we're going to focus on how to improve care and reduce cost, the bill is replete with opportunity. We can support accountable care organizations. We can support medical home pilots. We can support community health centers. We can support electronic medical records. We can support telemedicine. And we can support the Center for Medicare and Medicaid Innovation. That is how we're going to improve care, reduce cost, and deliver benefit to our constituents. I yield back.
Gentleman yields back. The gentleman from Iowa.
Mr. Chairman, I'd be pleased to yield 1 minute to the gentleman from New Jersey, Mr. Garrett.
Gentleman from New Jersey is recognized for 1 minute.
And I thank the chair. Just earlier, we heard the former speaker come to the floor just moments ago and said that she has now read the bill. Of course, we heard her famously saying before that we had to pass the legislation in order for her to find out what was in the bill. Well, I can tell you someone who has read the bill, and that is... No, I only have a minute, so thank you. So we can tell you who has read the bill, and that is the courts of this great country. And the most recent federal courts said they have read it, and they have found that the bill is unconstitutional. For this is the first time in the history of this country that the price of citizenship, this is the first time in the history of this country that the price of freedom, this is the first time in the history of the country the price of being an American is that you have to buy a particular product that some unknown, unfaceless bureaucrat in here in Washington ordains that you have to buy. We have come to the time that liberty is being taken away from us, that the strong hand of a big brother is reaching out and telling us, you have to do this and you have to do that as the price of freedom and the price of liberty. Yes, to answer your questions, yes, we will legislate. Yes, we will address health care. Yes, we will address the American people's interest in this area, and I commend the gentleman from Iowa on this amendment.
Gentlewoman from Connecticut.
I remind the gentleman that the courts are split 2 and 2. So with that, let me yield a minute to the gentleman from North Carolina, Mr. Butterfield.
Gentleman from North Carolina is ready.
I thank the gentlelady. Mr. Chairman, I rise in opposition to King Amendment number 267. It has been said that we are the sum total of our experiences, Mr. Chairman, and that is certainly true. My experience consists of growing up in a low-income minority community whose history dates back more than 150 years to slavery. I represent that district, the 1st District of North Carolina, the 4th poorest district in the country. My constituents, Mr. Chairman, overwhelmingly support the Affordable Care Act. Why? My constituents know that their insurance costs are soaring, exceeding more than 18% per year in increased costs. For those constituents who don't have insurance, they know that they will be able to qualify for Medicaid if their income is less than 133% of the federal poverty line. My rural hospitals, Mr. Chairman, know that finally when patients walk into their emergency rooms, the hospitals will be paid for their care and they will not continue to face bankruptcy. Mr. Chairman, this assault on the Affordable Care Act is unfounded, is unnecessary. I ask my colleagues to defeat this amendment.
Gentleman from Iowa.
Mr. Chairman, may I inquire as to the amount of time remaining for each side?
Gentleman from Iowa has 1 and 1¼ minutes remaining. The gentlewoman from Connecticut has 2 1/4 minutes remaining.
I'd reserve.
Gentleman from Iowa reserves. The gentlewoman from Connecticut.
Mr. Chairman, I yield 1 minute to the gentleman from Oregon, Mr. DeFazio.
Gentleman from Oregon is recognized for 1 minute.
Hang in there. There's another amendment.
The Republicans seem to be pretending that emergency room care is free. Every insured American's paying an extra $1,100 this year, $1,400 in Oregon, for those who are uninsured. We want to begin to address that problem. Get them in earlier. Get them treatment. Less expensive. Don't pass the costs on to other Americans. Personal responsibility. We outlawed the worst abuses of the insurance industry. Canceling your policy when you get sick, even though you've been paying the premiums. preventing people from getting health care because of a pre-existing condition. I heard from a dad whose young son with birth defects is finally getting covered for those issues because of this law. And then the students I met at Lane Community College, 21, 22, 23 years old, getting an education, wanting to get in the workforce, they thanked me for their health insurance. They need that health insurance. The Republicans said they were going to repeal and replace. Well, they've been pretty darn silent on the replace side, maybe because it upsets their patrons in the insurance industry who are so generous at campaign time.
Chairman's time has expired. Gentleman from Iowa, continue reserve.
Thank you, Mr. Chairman. I yield myself the balance of my time.
Gentleman from Iowa is recognized now for the balance of his time.
Thank you, Mr. Chairman. I really take issue with the gentleman from Bolivia that declared this to be nonsense. This is not nonsense. This is very, very serious business. This is the largest taking of American liberty in the history of this country. And the shenanigans that went on to put this bill in place, you could not have set this bill out on the floor of the 111th Congress and had it pass if it were all packaged up together in one big stack. It was two pieces of bills, and we listened to Dr. Burgess earlier about all of the things that took place to represent this bill in one place or another to put it together, including a promise of an executive order that was designed to trump the very Congress itself. And here we are with the first opportunity to put the brakes on Obamacare. Yes, we've passed the repeal H.R. 2. This is H.R. 1. It's here because it's more important to the Speaker than H.R. 2. And that means that we must shut off this funding to Obamacare. This CRS report, $105 billion automatically appropriated over a 10-year period of time that goes on in perpetuity, sending the tentacles of this malignant tumor down. It is metastasizing as we speak, and American liberty is being strangled off by Obamacare. This amendment is the amendment that shuts off all of the funding within the CR. It must be passed by this Congress to keep faith with the American people. I yield back.
The gentleman yields back. Gentlewoman from Connecticut.
Just let me inquire with the chair. It's a minute and a quarter that remains.
You have a minute and a quarter remaining, yes.
I yield the time to the gentleman from Washington State, Mr. McDermott.
The balance of the time?
Balance of the time.
Gentleman from Washington is recognized for a minute and a quarter.
Mr. Speaker, we've been here now the better part of 2 months, and we've seen a political theater go on and on and on. Each day we bring out something that seems like it might have some usefulness, but it turns out it's just more political theater. We read the Constitution in here. Why, that took us a day. Then we spent 9 hours arguing about a bill that we knew wasn't going anywhere. Then we brought out the health care bill. Then we keep doing this. Meanwhile, the American people are saying, and Bill Frist, now, I wouldn't say Dr. Frist was a good friend of mine, but he was the majority leader in the House, in the Senate, a Republican, a doctor who said, don't repeal this law, fix it. There have been no hearings in the 2 months about how you would fix the bill, and yet the American people, the problems that my colleagues come out here talking about one after another, are multiplied by the millions in this country. They know there's a problem. They don't want to repeal it. The numbers for repeal have been dropping as the people have seen more and more provisions of this law come into effect. They want you to fix it, not political theater. It doesn't help them in the emergency room or in the doctor's office. I yield back. The balance of my time.
Back, and gentleman, time has expired. The time has expired.
I move to strike the last word.
Gentlewoman is recognized for 5 minutes.
Thank you. I'd like to yield time to Mr. Andrews of New Jersey.
I ask unanimous consent to revise and extend my remarks.
Without objection, you are so ordered.
I thank the Chair. If I could just get the attention of the gentleman who's the author of the amendment, Mr. Chair, I want to yield to him for an answer question. The gentleman, my friend from Iowa.
In all defense, technically, the gentlewoman from Connecticut has to ask.
I would ask her to, at the appropriate time to yield for an answer. Here's my question. Let's say we have a person who's on Medicare who has $100 a week drug costs, and they hit the donut hole in August of the year. The way the law works right now is they will get help to continue to pay for their prescription drugs in the form of either a rebate in the future or a cash rebate in the past or a discount in the future. I wonder if the gentleman could explain to us what will happen to that Medicare recipient when they hit the donut hole if his amendment becomes law, and I would ask the gentlelady to yield to him for an answer.
I yield to the gentleman from Iowa.
I thank the gentlelady for yielding and the gentleman for his question on the donut hole. As I understand the current circumstances of the donut hole, there are many people in the lowest income who are not affected by the donut hole. I also recall when that part of Medicare was passed.
Reclaiming my time, I think we want to try to answer the gentleman's question.
Yeah, the question was, what about someone who's in the donut hole? What happens to them under your amendment? And I would ask the gentlelady to yield for the answer.
I yield to the gentleman.
To compress my response, I think it's a bit unclear because we don't know how the Secretary of Health and Human Services may respond when the funding is shut off because she has the ability to.
They reclaims her time.
Well, with all due respect, Mr. Chairman, it's not unclear at all. What would happen under the gentleman's amendment is the prescription drug price of this senior would go up dramatically, and they'd have to pay the entire cost of that prescription until they hit I think the $5,100 limit. The effect of this is substantive legislation. It will dramatically raise prescription drug costs for America's neediest seniors, and I thank the gentleman for her time.
I thank the gentleman. I'd like to yield time now to the gentleman from California, Mr. Garamendi.
I thank the gentlelady from Connecticut. And Mr. Speaker, when you take a look at what is happening here, the effort to repeal, to kill, to stop the Affordable Health Care Act is an assault on the American public. It's an assault on the American public, and it would turn back to the insurance industry their opportunity to deny benefits, to deny coverage. It's hard to understand how in this period of time, when we should be talking about building jobs, that our colleagues would put before us legislation that would, in fact, destroy over 800,000 jobs and destroy the opportunity for millions upon millions of Americans to have health care that they could afford, and for small businesses to be able to provide the health care to their employees and to receive a reduction in the cost of that health care. It is hard to understand why they would be doing this when we need jobs, when we need health care. And when you look across the broad impact of H.R. 1, it is an assault on the working men and women of the poor in this country. When you take a look at the tax proposals put forward by the Republicans, it is to benefit the high and the mighty and the wealthy, to the detriment of the working men and women of the poor of this country. This is flat-out class warfare against the working men and women of this country. It's plain and simple. Remove health care, you remove their ability to get health care, you remove their ability to be healthy and to work. You remove the clinics, you remove their opportunity to get health care. You cut back on Medicare and Medicaid, you remove their ability to have health care. It is an assault on the working men and women, the elderly and the poor in this nation. That's what it adds up to. I yield back my time.
Mr. Chairman, how much time remains in the 5 minutes?
The gentlelady still has 50 seconds remaining.
I would be happy to yield to this.
I move to strike the requisite number of words. I want to just say,
the gentleman will suspend. You may have the last 30
yes,
seconds.
I did. Yield 30 seconds to the gentleman.
I would just say to the gentleman from New Jersey that I was in almost all of the meetings in our caucus. This bill was read provision by provision, sentence by sentence, and we had the clerk, the staffers who wrote these provisions under the direction of our chairman at that time. This was carefully considered, and any idea from the gentleman from New Jersey that it wasn't is just an outrageous statement on his part, and he ought to be ashamed of himself.
How much time? Gentlelady still has 15 seconds.
I would just say that once again, what we're doing here, this amendment mirrors what the prior amendment where we had a discussion, and we keep saying it over and over again. Your inability to come here as you promised to create jobs for the American people, to lower the deficit for them, and to turn the economy around has failed in this effort.
All time having expired, the question is on the amendment offered by the gentleman from Iowa. Those in favor will say aye. Aye. Those opposed, no. Opinion of the chair, the ayes have it.
A recorded vote, please.
Gentlelady has asked for a recorded vote. Pursuant to Clause 6 of